Hello, my name's Kimberly. I'm going to be your nurse today. We're going to be performing a pediatric head-to-toe assessment on a school-age child. I'm first going to be assessing their developmental stage, their behavior, creating a stress-free and safe environment for my patient. I am going to ask them their name and their date of birth. Great. And do they have any allergies? No. Always also check their chart and ask their parents as well. There is not, and we've got permission to do the head-to-toe assessment. Okay. Can you tell me your name? Great. And do you know what year it is? Great. And do you know where you are? Great. Okay. Do you feel like hurting yourself or others? No? Okay, great. Okay. So now I'm going to go in and going to get my patient's vital signs. I'm going to check their blood pressure. I'm going to get their temp and check their oxygen. And I'm going to be counting their respirations. And when I'm doing that, I'm also going to be checking for symmetrical chest expansion and the quality of their respirations, which is good. And now I'm going to go ahead and do hand hygiene and start with their face. They have a nice symmetrical face. Everything looks good. I'm going to be checking their pupillary constriction. Great. Great. I'll be checking their mouth and their nose. I'm also going to be checking their ears for any drainage or earwax, which they do not have. And then, do you care to read that sign for me? ABG. Great. And now I'm going to be performing a whisper test, which is just where I stand behind them and whisper a word and have them repeat it. Great. Do it on the other side as well. Great. Okay, so now we have done that. I'm also going to have my patient swallow. Good. Okay. Now that we have done that, I'm going to assess my patient's gait. I'm going to have them get up and walk for me. While they're doing this, I'm going to be checking their balance and coordination. Everything looks good. I'm going to assess my patient's skin trigger on their chest and check their capillary refill. Good. Going to be assessing their carotid pulse bilaterally, but not at the same time. Their radial pulse and their pedal pulse. Everything looks good. And while I'm doing this, I'm checking the extremities for any edema and the skin color and temperature. Everything does look good for my patient. Now that we have done that, I'm going to be assessing my patient's arm. I'm going to have them turn their arm like this and do the supination with their hand, which they did. Have them do it for this one as well. Everything looks good. Gonna have them grasp both my fingers. They have good equal strength in both hands. Gonna have my patient take their arm and flex it up. And now I'm gonna be using opposing force and just having them test in every direction. Good. We're gonna do this bilaterally. Flex. Good. Okay. Now we're going to move on down to the lower extremities. And I'm going to have them lift their leg and keep their knee straight. And we're going to be testing the abduction and adduction of the hips. Have them go in and out. Out and in. Everything looks good. I'm going to have them put my hand on their thigh and have them raise their thigh. Everything looks good. I'm going to have them raise their leg up for me. We're going to be doing the opposing force in their lower extremity as well. So we're going to be doing this in every direction. Everything looks good. I'm going to be doing their feet as well. Have them do gas pedal. Looks good. Have them pull their toes towards them. Looks good. And then also no edema in the lower extremities. And put their blanket back on. Okay, now that we have done that, I'm going to be listening to my patient's heart sounds. Going to listen to the aortic, pulmonic, tricuspid, and mitral. I'm going to listen to their apical for 1 full minute. Everything sounds good. Now I'm going to listen to the 10 anterior lung sounds. The 4 lateral. Can I have my patient sit up for me? Now listen to the 10 posterior. Listen to the sides. And while I have my patient sitting up, I'm assessing their back for any redness, skin breakdown, which everything looks good, and assessing for scoliosis, which there's no signs of. They have a nice straight spine. Everything looks good. Have them sit back down for me. I'm now going to move on to their abdomen. I'm going to inspect the abdomen and listen to their bowel sounds now. Okay. They sound good and active in all 4 quadrants. Now I'm going to palpate and assess for any pain or tenderness or anything, and everything that's good, no complaints. They have a nice round soft abdomen. It looks good. I'm going to also assess my patient's perineal area for any breakdown, bruising, redness, itching, and everything looks good. I'm going to ask my patient about their appetite, what kind of foods they like to eat, how often they eat. I'm going to ask them about their bowel movements, have them describe it to me, how often they go. I'm going to have my patient tell me how frequent they urinate, urgency, if they have any pain or discomfort when they urinate, which they do not. And back up. So now that we have done that, we've already assessed their gait and everything. Everything looks good. Upper and lower extremities have good range of motion. We've done their turgor, vitals, heart, lung sounds, abdomen. We've done their pulses. Everything looks good. They have good behavior, good developmental stage for this child. Everything looks good. I'm going to report, record, and evaluate.